Going back to the story, so the young couple, they went to the pharmacist asking the advice regarding the family planning, okay? And after assessing this couple, the pharmacist came to a decision that oral contraceptive pill will not be ideal because this lady had some hypertension issue. And in case of hypertension, sometimes oral contraceptive pills is not recommended. So the pharmacist advised that barrier method would be ideal. So this is a true story I'm talking about. So barrier method would be ideal. So what is barrier method? Barrier method means using condom. Okay, very good. So this couple, the guy bought condom and went home. Very nice. No problem. Then after 2 months, the guy came yelling at the pharmacist. What happened? The lady got pregnant. The lady got pregnant. And the pharmacist initially thought that it could be like, that condom is not, it doesn't give 100% protection anyway. It doesn't give 100% protection. So that might happen because of the condom breaks or something. So when everything is cooled down, the pharmacist tried to talk to the guy because in this scenario, the pharmacist has to document the incident, or what happened, why did it happen, what could be done in the future, etc., etc. So when the pharmacist talked to this guy and he found that it's not about the condom break or some kind of use problem, it's something else. Can you guess what happened? Anyone? Okay, I'll tell you what's happened. Actually, what happened, because of language barrier or whatever reason, perhaps the couple, whatever they got in their life, sorry, in their life, they took it orally. Whatever they got from the pharmacy in their life, they took it orally. So instead of using condom, this guy swallowed the condom. Swallowed the condom, and also the lady. Both of them. Every single time before having sex. No wonder that the lady became pregnant within 2 months. There is no wonder. I mean, it's so weird example, but that's a true story. When pharmacists learned about this thing, that what happened, that instead of using the condom, this guy swallowed condom and took it orally, the pharmacist fell from the sky. I mean, his jaws dropped on the floor. How could it happen? I mean, is it possible that a guy of 26 or 27 years old didn't know how to use condom? Okay. That actually happened in this weird example. Now, in this whole story, I want you to write the answer. What's your opinion? Is it the couple's fault or the guy's fault or the pharmacist's fault? What do you think? I want you to write in the chat section if you understand. I mean, what's your opinion? Can you hear me? Is it the couple's fault or the pharmacist's fault? Jayati says it's guy's fault. Anyone? So everyone agrees with Jayati, or okay, Nahid says it's pharmacist's fault. Sharma said no one's fault. Okay, Timothy, pharmacist's fault. Adiva, pharmacist's fault. No one's fault. Okay, pharmacist's fault. Pharmacist's fault. Okay, nobody's fault because there was a communication gap. Okay. Okay, so the thing is like that. The majority are saying that this is pharmacist's fault. It is actually pharmacist's fault. When I mean, who told about the communication? Or you want to say, yeah, uh, Sadia most said that it's no one's fault. It's the communication fault. The communication. It's the pharmacist's responsibility to make sure that the message is communicated properly. So it's absolutely pharmacist's fault. Why? Because pharmacists assumed that a guy of 26 or 27-year-old, he would know how to use condom, but apparently he didn't. So that is the moral of the story, and we will actually talk about that. How could the pharmacist avoid this scenario in the later slide? So when you talk about the patient counseling, so the point is that never assume the patient knows. Doesn't matter how simple it is. Everybody knows that you had to take a tablet with a glass of water. But tell this to your patient, because you never know that someone, I mean, 1 out of 1,000 wouldn't know that and will do something weird things. And I mean, put himself in a awkward situation or in harmful situation. So the story of this, so the moral of this story is like, never assume the patient knows. No matter how busy you are, always try to communicate with the patient and try to understand whether the patient understood properly or not. Okay, so that's the thing we wanted to cover in the first lecture. We couldn't, so that's finished. Any question about this slide or anything, even about what we discussed before? If not, then we'll proceed. Okay, there is no question. I can't see. Okay, now we're going to talk about pharmacist-patient interaction or counseling. So mainly the pharmacist-patient interaction. What we are going to cover here, that when a patient goes to the pharmacy, hospital pharmacy, or a community pharmacy, what type of interaction actually happens between the pharmacist and the patient. Now, like I said in the beginning of, I mean, in the first session, that I don't want you to memorize anything. I want you to understand, because my opinion, and I believe that if you understand, then you can understand the next logical step. So I don't want you to memorize these whole steps, like introduction, rapport, information, DRP. DRP means drug-related problems, counseling, and closing. As a matter of fact, when you actually talk to someone, when you do some kind of conversation, you follow this structure without knowing. In your subconscious mind, you actually follow this one without reading any textbook. So why do you need to memorize this? Let me give you an example. Let's say you are going to Chittagong. Okay, you're going to Chittagong from Dhaka by train. Okay, so it was quiet in the morning, and I believe that you had to go to Kamlapur railway station. So when you went to the when you went to the railway station. Since it's quite morning, not many people around, but suddenly you could see a beautiful young lady sitting on a bench, sitting on a bench. You feel like talking. You feel like talking. By the way, I mean, if you are a female, you can think about that a young, handsome man is waiting on the bench. There is no problem with that. There is no gender discrimination on my part. It's just an example. You can think in your own way. Okay? So, okay, let's go back to the story. So, beautiful young lady sitting on the bench. You are going to Chittagong by train. It's quite nice morning and you feel like talking. So you approach to the bench and sit on the same bench, of course, maintaining a certain distance. The lady is not looking back to you, but you feel like talking, right? What did you do? What did you do? The first thing you do, you introduce yourself. Sorry. You introduce yourself. Suddenly, you say, okay, my name is X, whatever. Let's say Mispa. My name is Mispa. I'm going to Chittagong. So what you just did, that you introduce yourself, right? Now the lady, the beautiful young lady, doesn't seem very interested. So there is some kind of silence, awkward silence, because she doesn't seem interested. But you still feel like talking. Okay? You still feel like talking. After 5 to 10 minutes of awkward silence, suddenly, out of blue, you're saying, "Oh, today, what a nice weather today." Now, yeah, it's a nice morning, it's a nice weather, but the weather has been nice for last 7 days. There's nothing special about today. But you just said it. What did you just do? You actually develop rapport. What is actually rapport? Rapport means it's kind of ice breaking. There was some kind of awkward silence. So you said something, some kind of sentence like, what a nice weather. And you try to break that awkward silence. So that is the development of relationship or development of rapport. Let me give you another example. When we take Viva, let's say we take Viva, sometimes the teachers or I ask you that, have you taken your breakfast today? Have you taken your breakfast? Not that I care. I care that whether you had taken your breakfast or not. But on that day when I had to take Viva for another 30 students, they're waiting. Seriously, do I really need to ask you that, have you taken your breakfast? But I do. Why? Because it's kind of softballs. It's kind of ice-breaking question, that so that you don't become nervous and you can answer the following questions which would be asked in the Viva. So that is rapport. I think now the rapport is clear, that what is rapport. It's kind of ice-breaking stuff. Okay, so you introduce yourself, going back to that romantic story, you introduce yourself to the beautiful young lady. You develop the rapport. Now perhaps the lady is a little bit interested to you. And lady probably replied back to you, yeah, it is indeed a nice weather. Now you are fully blossomed. What is the next step? If you are thinking the lady is your future wife, then your next step would be to gather information. What type of information you want to know? You want to know her name. You want to know her address. You want to know her telephone number. And you want to know her age, perhaps. Um, because sometimes you know that because of the nice makeup artists nowadays, it's very easy to hide the age. Perhaps the lady is 20 years older than you. No, I'm just kidding. Actually, what the reason I bring up the age issue in pharmacy setting, date of birth is very, very important. Why? Because we find so many similar names, same first name, same surname. So it is difficult to identify. Then date of birth is a very reliable identification criteria. So that's why I want to emphasize on date of birth. Now, let me clear this one. It's crowded. So now, if you look at the whole story, you could see that you introduce to the lady, you develop rapport, and you gathered information. So do you really need to memorize? No. In normal conversation, you do it. You do it without knowing the sequence. Now, what is DRP? DRP is drug-related problem. It's quite difficult to fit in DRP in this story, but let's remember DRP separately. That after this introduction, rapport, info gathering, you have to go for drug-related problem. And then you had to think about counseling. The counseling is the main part we are going to discuss today, right? So DRP and counseling, just remember them separately. Now the closing. Let's go back to the story. What would be the closing? Your train came, you want to go home. Okay? Oh, sorry, you're going to Chittagong. You want to go to Chittagong. The lady will take another train. What did you do? You ask her phone number. You ask her phone number. But she is shy. She is not giving you the phone number. Not giving you the phone number. What did you do? You give your phone number. You make yourself available. Just in case if the lady changes her mind in the future, she would call you. That's why you gave your phone number, you make yourself available. So that's the closing. So you see that in the whole scenario, if you follow the story pattern, you can think about other conversation too. You actually follow this sequence. And DRP and counseling, this is something specific to pharmacy. Then the closing. Okay, just give me a second because I could see lots of pings. Maybe so many people are trying to attend, but they're late actually. Okay, that's it. I'm not going to accept anyone anymore. So that's the sequence. Okay. Now let's talk about details of the sequence, because actually this is the interaction. This is the main focal point of today's discussion. One thing I should mention, if you can remember from the first session, I'm sure that most of you can't remember. If you can remember, if someone can remember the sequence we showed, that first of all, when you go to the pharmacy with the prescription, you meet actually pharmacy staff. not the pharmacist. You meet pharmacy technician or pharmacy assistant or pharmacy staff, not the pharmacist. So the introduction part or the rapport part and info gathering, actually these three parts are done in real case scenario. It's done by pharmacy tech. Pharmacist, he or she does DRP taking, drug related problem, counseling, and closing. But that doesn't mean that you do not need to know how to do the introduction or rapport or information. You have to know it. Why? For two reasons. One reason, if it is a very small family pharmacy, it's owned by you, it's not a medium or big pharmacy, perhaps you are the only one staff in the pharmacy. You're the pharmacist and you are the only one. In that case, you have to do all of this. The second reason, in pharmacy setting, you are the manager. You are the boss, kind of. You're the boss to pharmacy staff, such as pharmacy assistant or pharmacy technician. So if a new pharmacy assistant or pharmacy technician joins, then you have to train them. So to train them, you have to know the whole sequence. And finally, I think the most important part is like to pass the exam. In theory, you have to know it. Doesn't matter in real case scenario, some parts would be done by the pharmacy tech, some parts would be done by pharmacists. You have to know all, okay? Right. Now, let's talk about the introduction. So what could be the introduction? When a patient comes with the prescription at your pharmacy for the first time, you can say, hello, my name is Misbah. I'm the pharmacist on DSC. How can I help you, or how may I help you? So this is your introductory sentence. Not necessarily that you have to use exact wording. You can say in your own ways. For example, you can say, hello, my name is Misbah. I'm the pharmacist here today. How can I help you? Whatever it is, but there should be some kind of introductory lines. That is the point, introduction. As a matter of fact, when you practice in reality, you'd see that sometimes patient comes to you and the patient doesn't wait for your introduction. Patient starts talking about his or her problems. That's okay. And you try to address from there. I mean, if the patient, let's say patient is saying, oh, sorry, the patient is saying that, okay, I'm suffering from I'm suffering from pain. And then you said, no, that's not the start. I have to introduce myself first, then you will tell your problem. In real case scenario, that doesn't happen, right? I mean, if the patient said, I'm suffering from headache, give me something, then you will not certainly stop the patient and would try to introduce yourself. So, of course, in real case scenario, it could be different, but you have to know that how the flow goes, because then you'd be able to improvise. First, you know the sequence, and then in reality, in practice, you'd be able to improvise accordingly if you have the theoretical knowledge. Okay, so the introduction part is done. So introduction is done. Now we are talking about this rapport. Rapport, we already gave example that you will develop some kind of relationship. Now, first of all, sometimes we say, I mean, in general cases, like, it's a nice weather, isn't it? Something like that. Like I said in the story, it has been nice weather in last since 7 days, but still we say it to break the ice or to ease the relationship, the pharmacist-patient relationship. If you see the patient is suffering from pain, you can say, I'm so sorry to see you are in pain. Let me see what can I do for you. So you can say that this is also a rapport sentence. If you can see the patient is pregnant, you can congratulate her. Like, you can say, okay, congratulations. I can see that you are pregnant. It must be very exciting for you. So you can say these sort of sentences. But for pregnancy, I think that it's better to wait sometimes. It's better to wait. Why? Let's say a patient came, and from the baby bump, you could see that the patient is pregnant. Now you're to develop the rapport, you're saying, um, oh, you're pregnant. Oh, that's so nice. I mean, it must be very exciting for you. You are enjoying your pregnancy, right? Something like that. You congratulated her. Congratulations, something like that. And after a couple of seconds, the lady replied in grumpy voice, you know what? This is unexpected pregnancy. I'm thinking of abortion. Now what happened? You already congratulated her, but this is unexpected pregnancy. So in that case, you have to eat your words, right? So sometimes it's better to wait. Otherwise, you will make yourself fool. Or maybe the lady would say, I mean, if you're overexcited, if you want to develop rapport, you congratulated the lady for pregnancy. And the lady said, no, I'm not pregnant, I'm just fat. So it's such an awkward thing. I mean, you try to break the awkwardness, but instead, you actually build a lot of awkwardness between this pharmacist and patient. So for pregnancy things, you had to be a little bit careful. One more thing I wanted to share, which is sympathy and empathy. I'm not quite sure that you know the difference. I guess that some of you know. What is sympathy? What is empathy? Sympathy is like, I'm so sorry to see you in pain. So you're showing the sympathy. Empathy is 1 degree extra. It's like you are putting your feet in their shoes. You feel the same kind of pain. So you can say, like, for if I want to convert this sentence to empathy, I'd say, I'm so sorry to see you in pain. I know how does it feel. So when you add the sentence, how does it feel? Then you are actually adding, this is the example of empathy. So now I think it's clear what is sympathy and what is empathy. Like I said before, empathy is 1 degree extra, but it doesn't mean, I mean, if you want to apply empathy all the time, you have to be careful because it has to be appropriate. What does it mean? Let me give you an example. A cancer patient came. Cancer patient came. He told you, I am diagnosed with cancer. To hear that, you replied to show empathy. I'm so sorry to hear that. I know how does it feel. Seriously, how do you know how does the patient feel? Are you a cancer patient? No. Is your family member cancer patient? No. So how do you know? How does it feel? So actually you're faking here. To show empathy, you're faking. That's not appropriate. And if you think about the principle we talked about in case of code of ethics, veracity is truthfulness. So be truthful. Just to show empathy, don't fake it. Okay? So empathy is good, but remember, it has to be appropriate. If you don't feel it, don't say, I feel it. If you don't have the experience, don't show that you can feel the same pain what the patient is feeling. So that's all the thing I wanted to clarify. So that's the report is done. Is there any question so far? I'm keeping an eye on the message. Is there any question? I believe no. Okay. Now the next point is information gathering. So the patient, for the first time, came to a pharmacy with a prescription. Let's give the same example that we used in the first lecture, that the prescription is amlodipine, 5 milligram, because the patient was diagnosed with hypertension, once daily, 90 tablets. This is the prescription. And this is the first time. So first time came, no profile with you. You had to create a profile for the patient. So what do you ask? And also try to compare with that romantic story you were talking about, what type of information you want to gather. So then you do not need to memorize these things. You can automatically at least pick up some of the points. So patient came with this prescription. So you as a pharmacist gathering the information. What do you ask? What's your name? What's your name? Can I have your name, please? Yeah, my name is Ms. Talukdar. What's your date of birth, please? It's 16 June. Okay, I don't want to know my year, so I'm not telling you year, but I can tell you I'm young. Okay. Okay, so it's 16 June. Okay. Gender, you can see I am male. Can I have your contact number, please? Yeah, it's 01712, etc. Then, do you have allergies? No, I don't have any allergies. If the answer is yes, I have allergies, I have peanut allergies, then you have to document in the system that I have peanut allergy. Okay. Now, medicines. In medicines, you have to ask 3 types of questions. What are the 3 types of questions? Do you take any kind of prescription drugs? Any kinds of prescription medication? No, I'm not taking any kind of prescription medication. Do you take any kind of OTC medication, over-the-counter medication? No, I don't take any kind of over-the-counter medication. Have you stopped any medication recently? No, I didn't. I didn't stop any medication recently. If the answer is yes for this, like for prescription medication or over-the-counter medication, or have you stopped any medication, or in that case, you have to document what medication are you taking, what OTC medication are you taking, what medication did you stop. Why? Because when you put this data in the system, the pharmacist would be able to check whether there is any kind of interaction or not. The pharmacist would be able to tell you. Of course, the pharmacist, in a real case scenario, pharmacist would take the help from the software, but he needs the information, right? So that you ask. So you ask name, you ask date of birth, you ask gender. Gender, you can see, you have contact number, you ask allergy information, you ask medication information, then you ask CASE. What is CASE? CASE is actually it's an abbreviated form. What does CASE mean? It's actually the information or the questions about your lifestyle. So after asking this question, you will ask me, I am the patient, that can I ask you some lifestyle question, please? I would say yes. What do you want to know? So what do you want to know? Before we talk about that, you have to understand what does CASE mean. So C stands for caffeine, A stands for alcohol, S stands for smoking, E stands for exercise, and D stands for diet. So you will ask me, or if I'm the pharmacist, you are the patient, I will ask you, Do you take any caffeine or tea? Yes, I do. How many cups? Well, average 3 cups of coffee I take on daily basis. Alcohol related question is probably not very relevant to in Bangladesh context, but it's very relevant in Western context like in Canada. So do you take alcohol? No, I don't. Do you smoke? No, I don't. If I say yes, I do smoke, as a pharmacist, you have to say, oh, okay, so if you have any plan to quit smoking, please let me know. We have some nice plans. I'd be able to help you. So by law, you have to offer, if someone is smoking, if the patient is smoking, you have to offer the program to quit smoking. Then you'd ask, do you exercise? I said, no, I don't exercise that much. How do you then last point is diet. How do you explain your diet? Is it healthy? Lots of fruits and vegetables? No, actually, I eat whatever I get. So now you took the lifestyle questions. Why is it needed? You will understand when we'll do counseling. You will see that why we took this lifestyle information, because they are relevant, and to advise on non-pharmacological measures we had to have this information. Okay, so we gathered the information. That's done. Is there any question? Is there any question at all? No, I don't see any question, so it's fine. So introduction is done, rapport is done, we gathered information. Actually, this is part of pharmacist, DRP. DRP, we already said DRP means drug-related problem. And there could be, DRP, it requires a separate class. I'm not going to in that direction. So I'll give you just one example because it's a huge thing. We had to talk about DRP because pharmacy is one of the main jobs. Let's say the same example, amlodipine. Sorry. So amlodipine, this is the prescription. But this time, instead of 5 milligram, I'm writing 10 milligram. Sorry. I'm writing 10 milligram. And instead of once daily, the prescription says that the patient would take twice daily for 90 tablets. Okay. Here, there is a drug-related problem. What is the drug-related problem? The problem is overdose. Because if you are recently diagnosed with hypertension, there is, if it is not exceptional case, most of the times it's not exceptional case, then it cannot be 10 milligram. It has to be 5 milligram. And it should be once daily. It cannot be twice daily. So there is a mistake in the prescription. There is a mistake in the prescription. So what's the problem? Problem is overdose. What would be the consequence? The consequence is like the patient would suffer from hypertension because the blood pressure was high, and now you're overdosing, the blood pressure will fall below the normal. So that is hypertension. I'll just sip water and that will be fine. Sorry. Thank you. So the consequence is hypertension. And the patient will also suffer from dizziness or headache. Okay. That's the consequence. What is the action? What are you going to do? I will contact the physician and clarify. So if I find any kinds of DRP, I will not dispense the medication. I will tell the patient, like, here, you see, you follow this sequence. I have a concern about this prescription. I think your amlodipine should be 5 milligram. In my opinion, it should be 5 milligram, but doctor prescribed you 10 milligram. If you take 10 milligram, there is a chance of hypertension and dizziness and headache. I am going to contact your doctor to clarify the prescription. I'm going to fax right now, and I will dispense the medication when I get the reply from the doctor. One thing I should tell you, I would request you to recognize. See, I know there is a mistake in the prescription, but did I say to the patient, the doctor did a mistake? No, I didn't. I said, in my opinion, it should be 5 milligram. I have a concern. I didn't say that this is a mistake, because this wording is very important. Even when I write to the fax, of course, I'll not tell the doctor, you did a mistake. And doctor, if I do a mistake, doctor will not tell me that you did a mistake, because certain wording is important, because then otherwise you will not have that reciprocal respect, the respectful relationship. So I will probably write a fax to the doctor saying that, like I said, the problem, I mean, doctor, I received this prescription for this patient. I have a concern. In my opinion, it should be 5 milligram amlodipine once daily. I guess that patient might suffer from severe hypertension. Could you please clarify the prescription? This is how. I'm not going to say, doctor, you did a mistake. Okay? So that's the point. I want you to recognize how you would communicate even in interprofessional relationship. Okay? So that's the end here. If I find DRP, there is no counseling, because I already informed the patient. There is no closing ID that I will dispense later on. Okay? So I could see that there was a question. Sir, is the smoking habit quitting program suggested only in Western countries? Well, actually, it's hard to say about Western countries. It depends on the provinces even. I'm not quite sure about the different provinces of in Canada. I know about Ontario. They have a smoking quitting program. So, so in that case, I mean, the thing is, like, when you get a registration, for example, if you get a registration in Bangladesh, although Bangladesh, we don't have regulated market, but still, if you get a registration, you get it from the Bangladesh Pharmacy Council. In Canada, in a similar fashion, we have different colleges. And in Canada, it's a little bit different because they have different provinces. I don't know how to explain this one. It will take, I mean, maybe 5 or 10 minutes, but provinces, they're different in terms of laws sometimes. So we have Ontario College of Pharmacy, we have Saskatchewan College of Pharmacy, we have Nova Scotia College of Pharmacy. So if I am registered with, let's say, Ontario College of Pharmacy, I am regulated by Ontario College of Pharmacy rules and regulation. So Ontario College of Pharmacy and Ontario Healthcare Program, they have the smoking quit program. Not necessarily the other province will have that. But if I am registered to Ontario College of Pharmacy, I have to do it because I'm practicing in Ontario, so I had to follow their rules and regulation, etc., etc. So that's the case. So going back to your question, is it for all Western countries? I guess no. It depends on which location you are in, and depending on that, they might have different programs. They might have different vaccination program. That the vaccination program, the BCG vaccination program we have in Bangladesh, we don't have in Canada. So that sort of difference we have, right? So smoking quitting program, not necessarily we will have it in every Western countries. That's my understanding. Thank you. If the doctor is not responding immediately, then what will pharmacists do? Shushmita, is a very nice question. Honestly speaking, by I can tell you two things. One is like in reality, that can you remember in the first class we talked about the circle of care, the circle of care. In the circle of care, um, the physician, nurse, and pharmacist, all of them are in the circle. So usually the doctors, they reply, because you have because when you call them, there is a separate line for pharmacists, because that's the priority. Because I am busy, doctor is also busy. So if doctors kill my time, that's a problem, because I would not be able to serve the other patients. And in I mean, ideally, it doesn't happen. Ideally, if you want to reach to the doctor and doctor is in surgery, in ideal case scenario, still you should be able to reach to the doctor, even the doctor is performing a surgery. It's that sort of priority. Okay. But having said that, you will always find that some doctors will not reply immediately. Even in pharmacy, can we reply immediately because we have so many jobs to do? So if that happens, you have to wait. And usually, if the doctor doesn't reply within 24 hours or 48 hours, there is a policy, you will refax. You will refax, okay? And you will try to call the doctor. But if now this is a very deep question. Um, the deep question in a way, if it is emergency medication, I don't know, it will take lots of time. So there are two things. One is like, if it is not emergency medication, let's say it's atorvastatin, you always have to apply your clinical judgment. Atorvastatin, the patient can wait. If the patient doesn't take atorvastatin 10 milligram, which is for anti-cholesterol medication, for 3 or 4 days, doesn't matter. But if it is something like um, some kind of very emergency medication, for even antibiotic is something emergency, or some kind of medication which is for myocardial infarction or something, which the patient requires right now, if the doctor doesn't reply, then we have to change the doctor, and we have to advise the patient to go to immediately to a nearby a different doctor, which is, we call it walk-in clinic. In some cases, if the doctor is not available and the patient was taking the medication for so long, for example, diabetic medication, he has been taking diabetic medication for 6 months or something, I, as a pharmacist, by applying my clinical judgment, I can give that medication without doctor permission. I'll just let the doctor know that I gave this medication to the patient. So when you are asking this question, if doctor doesn't reply, it depends on different scenarios. What are you do? It depends on the priority. It depends on the disease condition. It depends on the drug we are talking about. And depending on that, I will react or act differently. I think it answers your question. Thank you. Okay, so it's like the first session, we will only have 5 minutes. Do you want me to stop it within 5 minutes, or I can borrow another 20 minutes or something? I mean, I need your consent. If I don't have your consent, I cannot actually extend. Could you please let me know? Okay, sir, please continue. Please continue. Please continue. Okay, please continue. Okay. 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 Thank you very much. So I will continue, but if someone has to go because of some urgent, or you have prior engagement, please feel free to go. That's not a problem, because I already took the attendance, so that should be okay. Okay. Thank you. So anyway, so we talked about the introduction, we talked about the rapport, we talked about information gathering, we talked about DRP. Time after time, in every slide, I am referring to this sequence because I want you to recognize what I'm explaining. It's actually part of sequence. So when you are listening to details of a particular thing, don't forget that it's actually the part of sequence. So now we are here, counseling, right? Let's say there is no DRP. Let's say it's amlodipine 5 milligram, amlodipine 5 milligram once daily, and 30 tablets. Everything is fine. I checked the prescription. There is no problem, so I can dispense it. Okay. Pharmacy prepared the medication for the patient. Patient for the first time came to the pharmacy. First time he was diagnosed with hypertension. First time he's taking antihypertensive drug. So I had to counsel. So when I say counsel, what does it mean? Well, counseling, from the word you can understand, it's a conversation. But conversation, okay, I understand conversation. But what does it contain? What are the materials? What are the points you're going to discuss in counseling? These are the points. These are the topics I am going to talk about or I'm going to discuss in counseling. The way I remember, it's some kind of this mnemonic, which is DSDA, MOS, SN. DSDA, D stands for drug. S stands for strength. D stands for dosage regimen, how many times you had to take. A stands for administration. You had to take it with food or without food, with a glass of water or not, etc. M stands for mechanism of action. O stands for onset. I mean, if you take the medication, when would you see the effect, etc. S stands for side effects. This stands for storage. N stands for non-pharmacologic measures. Okay, so this is a prescription, right? I think this prescription is already familiar to you. I will tell the patient, what's the drug? Drug is amlodipine. What is the strength? And I gave the patient is PMS. PMS is a company, so PMS amlodipine. PMS amlodipine. What is the strength? 5 milligram. What is the dosage regimen? Once daily. You have to take once daily. It's from the prescription. How do you take it? It doesn't matter. You can take it with or without food. Amlodipine with or without food. It's better to take it with a glass of water so that you can swallow easily. Mechanism of action, it works on your calcium channel, and thus it reduces your blood pressure. Onset, it should work within 8 hours, but full antihypertensive effects, you have to wait 1 to 2 weeks. What is the side effects? You might feel little bit of headache, lightheadedness, and dizziness. This is the side effect. What is the storage condition? Please keep it out of children access and store it in cool and dry place at room temperature. What is the non-pharmacological action? Remember, then in information gathering, we asked about the lifestyle question. Here it is important, because based on that lifestyle information, I will now give some non-pharmacological measures. The patient said to me that I'm taking 3 or 4 cups of coffee. I'll probably tell him or request him, okay, can you please try to reduce the coffee or tea intake? The patient said, I don't exercise. Would you try some kind of moderate exercise? And aerobic exercise is better, because if you're hypertensive, aerobic exercise is better. Aerobic exercise means like open air, something like that. And the guy said that, how do you explain your diet? He replied to me, I don't care. I eat whatever I get. So definitely his diet plan is not good. I had to say, okay, you have to think about your diet. Try to eat vegetables and fruits. And also for hypertension, there is a special diet, DASH diet. Try to Google it and see whether you can follow it or not. Take less amount of salt, because if you take salt, that is bad for your hypertension. So these are the non-pharmacological measurements I'm telling to the patient, depending the information I gathered when I took the information. Okay, right. So in counseling, um, if I tell everything, how they counsel, I mean at once how they counsel, that um, doctor prescribe you amlodipine 5 milligram. I am giving you PMS 5 milligram amlodipine. You have to take it once daily, with or without food, doesn't matter, but try to take it every day on the same at the same time, and try to take it with a glass of water. It would be easier for you to swallow, and it will work on your calcium channel, and this is how it will reduce your blood pressure. You should see some effect within 8 hours, but since you are starting for the first time, to see the full antihypertensive effect, it might take 1 to 2 weeks. You might feel some kind of headache or dizziness, but if it is intolerable, please report back to me. I'll tell you what to do. um, and then you have to keep it, this medication, out of children's access, and keep it in dry and cool place at room temperature. And try to do some moderate exercise. Aerobic exercise is good. In terms of diet plan, I would recommend to follow the DASH diet, because it's good for hypertensive patient, and try to take less salt, because salt causes more higher blood pressure. See, this is how I'm counseling the patient. This is my format. Okay, so the counseling is done. Now, last time is closing. Now, I want to refer you back to the romantic story I told you. Okay, I'll talk about it later. Let's start with access clarity. What does it mean? It is always recommended that you assess the clarity. Patient came. The patient is elderly patient. Elderly patient. You counseled everything. I mean, the list I showed you, you counseled everything. How many you have to take it once daily, you have to take it with food, you had to take it with a glass of water every time. Do you understand what I'm saying? Yes. Do you understand what I'm saying? Yes. Every time, whatever you're asking, yes. Actually, this patient didn't understand anything. And even if he or she understood, she couldn't process it. And if you do not assess the clarity and you counsel the patient beautifully, everything is in vain. Because when the patient will go home, he will do something weird, like the example we said, that gave, the guy swallowed the condom, because the pharmacist didn't assess the clarity. Now the question is, how do you assess the clarity? You can assess clarity by asking question. You said to the patient, you had to take it once daily with food, let's say. You can ask after finishing the counseling, can you please tell me how do you take it? If the patient is able to tell you, answer your question, okay, I'll take it once daily with food, then you understand that yes, the patient understood. It's the same technique what we follow in the classroom. Teachers explain things. Then teachers ask the question to you. You probably don't like it, but teacher asks, right? Teachers ask the question to you and you reply. And if you can reply, then teacher understands, okay, they understood. In the same, the weird example we gave, that the guy swallowed condom. If the pharmacist asked, okay, do you know how to use condom? Perhaps because of the language barrier, the guy would say, yes, yes, yes. Maybe he doesn't know, but still he said yes. But if the pharmacist questions back, can you tell me how? Now, you might say it's kind of private question. Okay, in pharmacy, we have a nice and cozy room. I mean, if you had to do some kind of private talk, you can always take the patient to that private room and ask the question. So if the pharmacist assess the clarity, that wouldn't happen. So assessing clarity is very, very important, and that you can do by asking question. I think it's clear. Now the follow-up. Follow-up means, like, okay, the example we gave, that amlodipine 5 milligram, amlodipine, sorry. So amlodipine 5 milligram, I counsel everything is done. Then I had to say the patients that, okay, so do you have any question? I mean, in the counseling part, I have to ask actually this question here. Do you have any question? If the guy has any question, then I had to answer this question. And in the follow-up method, if the person doesn't have question, you have to say, okay, you start taking this medication from today, and I will call you after 3 to 4 days to find out that how you are feeling, whether you are feeling any kind of, whether you are suffering from any kind of bothersome side effects or not. So that's the follow-up. You will call the patient. Okay? Now, make yourself available. What does it mean? Here, I wanted you to refer back to that romantic story. You wanted the phone number the girl didn't give you. Then you gave your number. Why? You made yourself available. So here, you, the pharmacist, will give the number to the patient and make yourself available. That you would say, okay, this is the number, this is my pharmacy number. If you feel any kind of bothersome side effects or any kind of question you have, please call us at this number and we'll be able to help you. So that you will then make yourself available. So first, in closing, you assess the clarity, then follow up, then make yourself available. So this is how your interaction going on, and this is the counseling and closing you're doing. Okay, so